So we are at the discussion of sympathomimetic amines. So regarding dopamine, we already discussed with the low dose. And next is the medium dose, that is 2 to 5 microgram per kg per minute. So 2 to 5 microgram per kg per minute. So at this dose, it stimulates beta-1 receptor and increases myocardial contractility as well as cardiac output. So stimulates beta-1 receptor and increases myocardial contractility as well as cardiac output. And that also leads to increased glomerular filtration rate. That also leads to increase in the glomerular filtration rate. So at the low dose, at the medium dose, it is showing beneficial effects by increasing the fluid elimination to the body. So from the body. And next, at high concentration, what it is doing, let's see. Just a second. So the high concentration, sorry for inconvenience. So at high dose, means here the dose is greater than 5 microgram per kg per minute. So that is greater than the 5 microgram per kg per minute. At here it causes generalized vasoconstriction. So the beneficial effect is observed at low to the moderate doses. So to increase glomerular filtration rate, GFR rate, the renal artery should be dilated. If they become constricted, the diameter of blood vessel decreases, the amount of blood flow in the form of ultrafiltrate also decreases. Okay, so there should be a no vasoconstriction. So at this dose, there is a vasoconstriction, and this dose is not beneficial for the treatment of congestive heart failure. And regarding dopamine, it is used in cardiogenic shock as well as acute heart failure with renal impairment. So abnormality in the kidney function.
Sir, which receptors are targeted in generalized vasoconstriction?
Sorry?
Which receptors are targeted in generalized vasoconstriction?
Even here also dopamine receptors only. But sorry, here there is a target by the beta-1 receptors as well as alpha receptor also. There is a chance of alpha receptor also, because alpha-1 receptors present in the blood vessel. If alpha-1 receptors are activated, if alpha-1 receptors are stimulated, what will happen? There is a vasoconstriction. So that is because of vasoconstriction. So here there is involvement of alpha-1 receptor also. Okay.
Okay, sir. Thank you.
Okay. And next is the dobutamine. So dobutamine simply it is a synthetic derivative of the dopamine. It is a synthetic catecholamine, acts on beta-1, beta-2 as well as alpha-1 receptor. So it is a non-selective drug. Can show action on beta-1 receptor, beta-2 receptor as well as alpha-1 receptor also. So this is simply about sympathomimetic amines. So regarding dopamine, the point is it is a selective inotropic. So inotropic means increases number of contraction. When contractions increases, cardiac output increases. GFR increases, urine output also increases. And after that, this dobutamine used in short-term treatment of acute heart failure as well as cardiogenic shock. And next is phosphodiesterase enzyme 3 inhibitors. So there are different types of phosphodiesterase enzymes present in the body. And here one of the enzyme we are going to discuss is phosphodiesterase enzyme 3. Phosphodiesterase enzyme 3. And this phosphodiesterase enzyme 3 inhibitors are also known as ionodilators. So one side they are causing inotropic action, increasing contraction, and one side they are producing dilation, vasodilation. So that's why these are known as ionodilators. That's why these are known as ionodilators. So ionodilators means by inotropic action they are producing contraction. By the dilation they are producing vasodilation. Because of that, these are called as ionodilators. I will discuss clearly. Don't worry. So because produces contraction on myocardium and dilation on blood vessels by inhibiting phosphodiesterase enzyme 3. So generally phosphodiesterase enzyme అంటే normally phosphodiesterase enzyme is there. It decrease the cyclic AMP level, secondary message. But here what we are doing, we are inhibiting the phosphodiesterase enzyme 3. If phosphodiesterase enzyme 3 inhibited, cyclic AMP levels increases. That is cyclic adenosine monophosphate, a secondary messenger. The role of cyclic AMP on the cardiac muscle contraction, the role of cyclic AMP on the blood vessel is dilation. Okay, so even if you know the cyclic AMP on the cardiac muscle causes contraction, and remaining all smooth muscle, the cyclic AMP causes relaxation. For example, bronchial smooth muscle also it causes relaxation. And these ionodilators used in short-term treatment of severe heart failure. Okay, so again ambrinon is less potent, can causes arrhythmias and can causes thrombocytopenia, reduction in the thrombocytes, platelets. And milrinone is a 30 times more potent than the ambrinon, but does not produces thrombocytopenia. అంటే ఈ రెండిట్లో చూసుకుంటే కనుక మిల్రినోన్ ప్రిఫర్ చేస్తారు ambrinon తో పోల్చుకుంటే. సో పొటెన్సీ is nothing but how much quantity of a drug required to produce its action. So how much quantity of a drug to require to produce its action is called as potency. So based on that, so milrinone is 30 times more potent than the ambrinon. So ambrinon తో పోల్చుకుంటే milrinone కి తక్కువ డోస్ సరిపోతుంది. For example, morphine, pethidine. So morphine require 10% of dose. Morphine require 10 mg, for example 10 mg to produce analgesia, pain relief. But pethidine require 100 mg of dose to produce analgesia. So here morphine is 10 times more potent than the pethidine. So pethidine లాంటి యాక్షన్ ప్రొడ్యూస్ చేయాలంటే మార్ఫిన్ కి 10 mg చాలు. బట్ మార్ఫిన్ లాంటి యాక్షన్ pethidine ప్రొడ్యూస్ చేయాలంటే 100 mg కావాలి. So based on that we discuss that okay, this drug is this much potent than compared to other drug. So that is simply potency. So these drugs are called as ionodilator. When phosphodiesterase enzyme 3 inhibited, cyclic AMP levels increases. That cyclic adenosine monophosphate on heart produces contraction. On heart produces contraction. Next continuation, nesiritide. Continuation, next drug is the nesiritide. So it is a recombinant form of BNP, B type of natriuretic peptide, and the common drawback is hypotension. The common drawback of this nesiritide is hypotension, and it can be used in clinical uses like mnemonic as a DAT, like decompensated heart failure, and it can be also used as a vasodilator, and it can decrease the dyspnea of congestive heart failure. So dyspnea means a abnormality in the breathing. సో సడన్ సెజేషన్ ఆఫ్ బ్రీతింగ్ అంటే బ్రీతింగ్ లో కొంచెం అబ్నార్మాలిటీ రావటం, బ్రీతింగ్ లో డిఫికల్ట్ గా ఫీల్ అవటం జరుగుతుంది అన్నమాట పేషెంట్. సో దిస్ ఈస్ సింప్లీ అబౌట్ nesiritide. So that is simply about nesiritide. Next, regarding diuretics. So as we know that This is the disease mainly because of excess accumulation of body fluids in the body as well as in the heart. So in this disease, the first therapy should be start with the diuretics, because diuretics will eliminate excess body fluids from the body as well as a heart, and by this decreases workload on the heart, decreases workload on the heart, and the heart works normally. So heart normal గా పనిచేస్తుంటుంది కాబట్టి సరిపోతుంది. బట్ ఏమవుతుంది, కంజెస్టివ్ హార్ట్ ఫెయిల్యూర్ లో ఒక్కసారిగా ఫ్లూయిడ్స్ అన్ని కూడా హార్ట్ లో వచ్చి అక్యుములేట్ అయిపోతాయి అన్నమాట. సో దట్స్ వై కంజెస్టివ్ హార్ట్ ఫెయిల్యూర్ ట్రీట్మెంట్ అనేది డైరెటిక్ తో స్టార్ట్ అవ్వాలి. సో డైరెటిక్స్ ఆర్ ద ఏజెంట్ increase the elimination of body fluids through the urine, that is excess body fluids, that is excess body fluids. ACE inhibitors. So generally ACE inhibitors are also standard therapy for the congestive heart failure treatment. So regarding ACE inhibitors, we already discussed regarding the antihypertensive class of drugs, antihypertensive class of drugs. Next, beta blockers. So the last but not least, that is beta blockers. Long-term therapy with beta blockers decreases symptoms of CHF, reduces hospitality risk as well as decreases mortality rate. అంటే బీటా బ్లాకర్స్ కనుక కంటిన్యూస్ గా వాడుతున్నట్లయితే, ఎవరు కంజెస్టివ్ హార్ట్ ఫెయిల్యూర్ తో సఫర్ అవుతున్న వాళ్ళు బీటా బ్లాకర్స్ కనుక కంటిన్యూస్ గా వాడుతున్నట్లయితే, సో వాళ్ళు హాస్పిటాలిటీకి వెళ్ళే తగ్గడంతో పాటు వాళ్ళు చనిపోయే ప్రమాదాన్ని కూడా తగ్గించే శాతం ఎక్కువగా ఉందని చెప్తున్నారు అనమాట. సో దట్ ఈస్ బీటా బ్లాకర్. సో ఇన్ ద క్లాసిఫికేషన్ ఇట్ సెల్ఫ్ ఆల్సో ఐ మెన్షన్ ద బీటా బ్లాకర్స్. The classification itself also I mentioned regarding the beta blockers. Okay, so simply congestive heart failure nothing but there is a heart is unable to perform its function. So simply the heart is unable to perform its functions. So especially what is happening here, the excess fluids are accumulating in the heart, and there is a increasing overload on the heart also. There is a increased overload on the heart also. So when there is a load on heart increases, the heart is unable to perform actively. If heart is unable to perform actively, the cardiac output will be decreases. If cardiac output decreases, the amount of blood flow to the body organs decreases. If amount of blood flow to the body organs decreases, the body organs not function properly. That's why congestive heart failure categorized as a multi-organ failure. It should be treated immediately. Otherwise, it may leads into the severe disease of the heart, that is congestive heart failure or congestive cardiac failure. So what is the meaning of natriuresis?
So sodium
Eliminate
excretion.
of sodium in the urine.
So increases
Urine.
elimination of sodium through the urine. So what are the examples of ionodilators?
Dopamine, dobutamine.
Very good. Amrinone, milrinone are ionodilators. Yes, they are known as phosphodiesterase enzyme 3 inhibitors, because phosphodiesterase enzyme 3 is present in the heart as well as blood vessel. Phosphodiesterase enzyme 3, amrinone, milrinone. Okay, so what is the recombinant derivative in the treatment of CHF? Recombinant form of derivative? Nesritide. Nesritide. So what is the drawback of nesritide?
Hypotension.
Hypotension. So what is the importance of diuretics in the treatment of congestive heart failure?
Increase glomerular filtration, thereby increase urine output.
Yes. So first, initially it increases glomerular filtration rate. Glomerular filtration rate. So what are the example of sympathomimetic amines in the treatment of CHF?
Dopamine,
Dopamine.
dopamine and dopamine.
Okay. At which dose dopamine producing toxic effects, non-beneficial effects?
High dose.
Greater than 5 mcg per kg per minute. That is high dose.
Greater than the 5 microgram per kg. Nothing but kg body weight. Even if you're performing experiments in pharmacology also, will calculate based on that. Generally, rat will be 150 grams, 200 grams, around that. So, but we will calculate to the per kg. So, per kg this much. So, for 150 gram, this much. So, like that, also in human beings, we will calculate the dose. So, why phosphodiesterase enzyme 3 inhibitors are called as ionodilators?
Because it produces contraction or myocardium.
It produces contraction of myocardium as well as vasodilatation.
Okay, so what happen if phosphodiesterase enzyme 3 inhibited?
Increase in the CAMP levels.
That is
Increase in
cyclic
CAMP levels,
adenosine
calcium levels.
monophosphate levels. So what is the role of cyclic AMP on the smooth muscle?
It produces contraction.
Contraction.
On smooth muscle relaxation. On the cardiac muscle contraction. On the smooth muscle relaxation. Even I hope you know mechanism of beta 2 agonist, that is salbutamol. Salbutamol is a beta 2 receptor agonist. Increase the cyclic AMP level. Increase the cyclic AMP levels. So, and bronchial, nothing but bronchi is a smooth muscle. On the smooth muscle, increasing cyclic AMP leads to relaxation, and that decrease the asthma. And what is the secret behind that relaxation means? On the smooth muscle, what is happening? There is inactivation of myosin light chain kinase. Myosin light chain kinase. So, due to inactivation of myosin light chain kinase, there is a relaxation. But in case of myocardium, there is a activation of myosin light chain kinase, produces contraction. And even if you want some more clear explanation, you can get it in the Wilson and Gisford, a medicinal chemistry book of Wilson and Gisford. So what is happening? Why cyclic AMP producing relaxation on the smooth muscle? You can get it in the Wilson and Gisford medicinal chemistry textbook. Okay, so what are the example of aldosterone antagonist? What are the examples of aldosterone antagonist? Eplerenone as well as spironolactone. So generally spironolactone is a non-selective in nature. It can block other receptors also instead of aldosterone receptor. And the spironolactone can produce gynecomastia also. But eplerenone is a selective aldosterone receptor blocker. Eplerenone is a selective aldosterone receptor blocker. So aldosterone also known as
Antidiuretic hormone. Antidiuretic hormone.
No.
Vasopressin.
No. Aldosterone is also known as mineralocorticoid because
Yes, sir.
it causes retention of sodium, one of the mineral. That's why it is known as mineralocorticoid. And aldosterone function is sodium and water retention. If sodium and water retention become excess, that leads to increased body fluids. That's why we have to block aldosterone receptor by using eplerenone or spironolactone. If aldosterone action opposed, no sodium water retention, decreased body fluids. And vasopressin also known as antidiuretic hormone. So based on its function on blood vessels, increase the pressure, blood vessel. Vaso means blood vessel, pressin means rise the pressure, vasopressin. And on the kidney, oppose the urination, antidiuretic hormone. And vasopressin binds to the vasopressin receptors, both are G protein coupled receptor. And you know, 60% of receptors in the body are G protein coupled receptor. G protein coupled receptors, also known as metabotropic receptor, serpentine receptor, 7 transmembrane heptahelical receptor. So, what are the example of vasopressin receptor antagonist?
Tolvaptan and conivaptan.
Very good. So which one is selective, which one is non-selective?
Tolvaptan is selective and conivaptan is non-selective.
Tolvaptan starts with the letter T, so target single, that is only one receptor. And conivaptan is a non-selective. So what are the example of beta blockers in the treatment of CHF?
Metoprolol,
Metoprolol, carvedilol, nebivolol.
Nebivolol. So what are the example of selective beta 1 receptor blockers?
Metoprolol.
Metoprolol, esmolol, atenolol.
Propranolol.
No, propranolol is a non-selective. Non-selective.
Yes.
The propranolol, because of its non-selectivity, it is contraindicated in asthma, not used in asthma. It may increase the severity of asthma.
Bisoprolol.
Yes. So how digitalis glycoside producing negative chronotropic?
By vagal stimulation.
By vagal stimulation. So as we know, vagus nerve is the 10th cranial nerve. When vagus nerve is innervated, it stimulates parasympathetic nervous system. When parasympathetic nervous system stimulated, it releases acetylcholine. That acetylcholine on heart decreases number of beats. And when vagus nerve innervated, it releases a substance called as acetylcholine. That's why acetylcholine also known as vagus stuff. Nothing but stuff is nothing but material. Stuff is nothing but material. That is vagus stuff. The material releasing from the vagus nerve, that is vagus stuff. The vagus stuff also known as acetylcholine. So acetylcholine binds to which receptors?
Beta.
So generally, not from the class. So it can binds to muscarinic as well as nicotinic receptor. Nicotinic receptors are two types are there. NMNN, nicotinic muscle type, nicotinic ganglion type. Nicotinic muscle type located on the skeletal muscle.
NNN is ganglia, present in ganglia.
Okay, please let me. So NM on the skeletal muscle, NN on the neuronal ganglia. Okay, and there are muscarinic receptors. All 5 types of muscarinic receptors belongs to G protein coupled receptors, like M1 receptors in the CNS as well as GIT, M2 receptors on the heart, M3 receptors on the smooth muscle as well as glands, and M4, M5 receptors are present in the CNS. That is CNS, central nervous system. So here the CHF is nothing but simply we have to, regarding treatment, we have to eliminate excess fluids from the body. So what is the example of vasodilator? Can you give some examples of vasodilators? Nitric oxide, potent vasodilator. The nitric oxide also known as gaseous neurotransmitter in the body. The nitric oxide also known as gaseous neurotransmitter in the body. So nitric oxide is, that is N2O, nitrous oxide. NO, nitric oxide. Okay. NO is a nitric oxide, that is a potent vasodilator, and it is also known as EDRF, endothelium derived relaxing factor. EDRF, endothelium derived relaxing factor. So nitric oxide is a vasodilator. Prostaglandins also vasodilator. Bradykinin is also a vasodilator. Some other substance like substance P. So let into, there are number of things are there. So, and N2O. N2O is a nitrous oxide which is a general anesthetic. The gaseous general anesthetic. Okay.